Hello, my beautiful friends. Today is Tuesday, June 4th, and I am getting ready to go see my dermatologist to do a full body skin check. But what triggered me to want to go is I have this freckle on the back of my ear that I noticed while I was taking photos of my hair growing back after chemo. When I looked at the back of my head, I noticed on my ear there was a freckle, and I zoomed in and I'm like, let me go get that checked. But I was waiting until radiation was done to go get checked because I want them to check everywhere, including what was radiated, because I noticed there's like quite a collection of freckles going on in that spot. And I just want to get checked anyway. It's very good to check your body. Always advocate for yourself, and early detection is key to survival. So I'm going to get on the road and I will see you in the next clip. Room tour. And I'll be sitting there. And then my cool paper gown. How fancy. All right, I'll see you in the next clip. Okay, well, I am all done. My dermatologist appointment, it went really well. That freckle thing on the back of my ear is nothing. It's just a mole. It's like a skin-toned mole / freckle, more on the mole side. He told me that he's like, you just have a lot of moles. He's like, nothing looks abnormal at all. He checked my entire body, my toes, the top of my feet, the bottom of my feet, top of my hands, bottom of my hands, armpit, back, you name it, he checked it. And he just said, you have a lot of moles. He's like, the typical patient will have like 20 to 30 moles around on their entire body, and I have close to 150. He's like, between 120, 150. I was like, holy moly, like literally, I'm like a moly person, and I have a lot of freckles too. I was like, what is that? Is that because I'm like half Irish or something? Because I know if you're Irish, you got freckles, like you're prone to getting freckles or having them genetically. And he said, no, it's just genetics, like it's hereditary. And my mom has a lot of freckles and not a lot of moles though. I don't know where I got these moles from. Somebody in my lineage, in my ancestry, gave me that. So yeah, I'm happy. I asked about like sunscreen and like what's like the best kind to use, especially having gone through cancer treatment and radiation, and just to avoid getting skin cancer in general, like even if you don't have a cancer diagnosis. And he gave me a whole bunch, which I didn't even realize till I went to look in this bag, but a whole bunch of samples. Let me come down here. Let me open this bag a little better for you. A whole bunch of different samples of sunscreens and things to try, and whichever one I like best, get it. But he said that there are no actual studies done to prove the difference between, what did he call it? Mineral lotions versus chemical sunscreen lotions. Like chemical would be like the big name brands that you know of, and the mineral ones would just be mineral lotions. I'm not a specialist by any means, clearly, in this field, but that's good to know. As long as you're protecting your skin, that's the most important, because you don't want to get melanoma. He also said that 95% of people don't get melanoma. It is just good to annually, or even like every 2 years, it should be every year. If you're out in the sun a lot, for sure, every year, get your skin checked, because what's the worst that could happen? You just spent, like me today, 45 minutes of your day and found out good news that you don't have anything suspicious that might need to get burned off or cut out, or like a Mohs surgery, any of that to prevent skin cancer. I think that's worth it. I mean, 45 minutes is worth that. So advocate for yourself, go get your skin checked, and you know, it's always good to be on top of things, because the early detection is key to survival. All right, so I'm gonna head home, and I have another, what else do I have? I don't think I have anything else this week, but I do have next week on Monday, which I'll continue into this video, a follow-up appointment with my oncologist. So we're probably gonna discuss me beginning Verzenio, which is the targeted therapy. I keep calling it a chemo pill, but it's a targeted therapy pill. All right, so I'll see you in the next clip. Good morning, friends. It is Monday, June 10th, and I'm getting ready to go meet with my oncologist for a checkup and a check-in before I begin my Verzenio pill, I'm assuming. I'm going to bring up the topic of the DEXA scan to see if she's going to send me off to get that, or if we wait a little bit. And I'm pretty sure I have to get blood work done again, maybe, to get like a baseline before we start Verzenio, because it's a targeted therapy pill. I keep calling it a chemo pill, but it's a targeted therapy pill. Also, two more things. Even though I'm not in radiation anymore, I'm still going to tell you your daily reminder to stay hydrated, because it's always important to stay hydrated, whether you are going through cancer treatment or not, because your body will thank you for it. Trust me, it's very good to stay hydrated always. And lastly, I swear, every time I'm like, I'm not going to wear my wig today, I'm going to go all natural. It's chilly. And on the days I wear my wig, it's like 1,000 degrees outside. But it's all good. It's supposed to warm up in a little bit. It's like 60 degrees here, but it's just a little chilly because I'm in the shade. I don't know. But I got to get on the road and get to my appointment. So I will see you in the next clip. quick, I'm gonna do a room tour. Hold on. I thought somebody was coming in. Room tour. Ooh, beachy. Room tour. I haven't done a room tour since radiation, so room tour. And then I have a couple questions to ask my oncologist, and I'll share everything with you in the car. So I will see you in the next clip. Just kidding. I totally did a room tour at my dermatology appointment. But whatever. You got another one. All right. See you in the next clip. Okay, I'm back in the car. I got quite a bit of information today, and I'm probably going to miss a lot of it in this update part of my vlog, but anything I forget, I'll just put like a little sticky note over here and edit what I forgot, or if I'm mispronouncing things or forgetting the dose of things. But first things first, everything looks really good. I'm doing really well. I'm feeling really good. I have to go get blood work done just to get a baseline before we begin the Verzenio, which is the targeted therapy pill. That pill will be taken twice a day, in the morning and in the evening. There are side effects to that pill, and the main number one that pretty much almost everybody gets is diarrhea. And I looked at her and I was like, it's no big deal. And she's like, well, you don't want to have that because it can obviously mess with your electrolytes and make you feel horrible. But she said that they closely monitor the first, I'm going to guess like month-ish when you're on it, just to see how severe you get diarrhea or if you get it at all. And they control that with Imodium. So I asked, I was like, does every one of your patients get diarrhea, or is it just like some people? She's like, not everyone gets it, but most do. And I was like, great. Well, hopefully I'm one of the not many get it people, because I do try to live a pretty healthy diet and lifestyle to hopefully help my body not react that way. So I got blood work, paperwork for that, to get a base number. Also, that drug, the Verzenio, has to be ordered from a specialized pharmacy. I forgot. I'll put the word here. And it does not go to like my regular pharmacy where I pick up my other prescriptions. It has to be delivered directly to my house. So when it's delivered to my house, I call her and let her know I got it, and we pick a date to start it, because she said in the event that you do end up with diarrhea or you have any type of side effects, you know, we just want to make sure it's on a day that you're ready to start. And if you have those side effects like immediately, typically you'll know if you're going to react to within the first 24 hours. At least I'll be home. I won't be like having plans with my daughter the next day, or being out somewhere and then I have explosive diarrhea. I don't know. Am I going to get it? I hope I don't, because who wants that? Anyway, I also got a script. So I have all these papers. I got a script for the DEXA scan, so that's cool. I'll go get that done before I start any other new drugs. I also got a dental clearance form, because I just had a cleaning and everything's good, but they just need a clearance from my dentist to ensure that there's no future dental work that needs to be done on me, like a root canal or implants or whatever, anything major. Because I also have to get, I don't know when I start this, probably, I don't know when I start this actually. I'm gonna guess like a month and a half out, maybe 2 months out. So I also have to get zoledronic acid. I think I'm saying that right. I'll put the spelling of it up here. And that is given as like an infusion, like on an IV, for 10 minutes, very slowly, over 10 minutes. At the infusion center where I got chemo, but I'll actually be at a different location that's closer to my house that finally opened up. That is a bone strengthener, and that helps because the Arimidex and the Zoladex that I'm on suppress estrogen in my body, because my cancer is an estrogen-fed cancer. And having low levels of estrogen in your body can cause your bone density to get lowered. It could weaken your bones. It causes bone thinning. So this is to help with that. I also take D3, vitamin D3, so that helps. Having calcium-rich foods in your diet helps with your bones. So that's why we're going to do the DEXA scan first to get a baseline to see what it looks like right now before anything goes in and really like messes with it. I've been on hormone therapy for almost 4 months now. So if anything's starting, we'll be able to see that. And then we'll do another DEXA scan. I'm assuming 6 months out, maybe a year out, to see how my bones are doing, if they're getting worse or the same, if they're staying the same. Hopefully staying the same. I also asked too, how long am I on the Zoladex injections for? Because in my last vlog, or last video, I was like, I forgot if it's 2 years or 5 years. It's 5. So I'm going to be getting injected monthly for 5 years. Also, I told my oncologist about my random hot flashes that I'll get. It's totally normal. It's part of the whole hormone therapy. But they're not terrible, and they're really far and few between. But when I get them, I'm like, woo! Somebody just turned on the oven or the outdoor heating lamp outside, blowing down my neck. It lasts for about 2 to 5 minutes, and then it goes away. That's so fun, especially in summer. And then the last thing that I told her about, now, this happened to me, I think like a year or two ago, before cancer was even known of in my life or showed up in my life. The top of my left foot, I had like, it felt like the beginnings of arthritis in a way, but it only happens in the summer because I was wearing improper footwear. I went to a podiatrist because it's like the bones, I'm going to use my hands as an example. The bones at the top of your feet, see they're wiggling, the ones that connect to your ankle, they would just randomly, like I'd be sitting on the couch with my feet up on my ottoman, and all of a sudden I'm like, whoa, it feels like a lighter, like fire is on top of my foot. And I thought it was arthritis, but I mean, it could be, it might be, I don't know, but it's because of wearing improper footwear in the summer, like flip-flops, because there's no support. I have hammer toes, I have a high arch, I shouldn't be wearing flip-flops, so I stopped wearing flip-flops. But I did wear flip-flops recently in my backyard because we're trying to grow grass out there. It's a whole thing. But I have since lost weight, so those flip-flops are pretty loose on me. So my toes are like trying to keep my shoe on, if that makes sense. So they're like super extended. Anyway, that's been flared up again. And she did say it's common in the aromatase inhibitors class of drugs. It can cause joint pain and like pain in your elbows, your wrist, wherever your joints are, and the top of the foot is one of them. But I don't know if it's specifically because of the Arimidex and what I'm on, or if it's because I wore flip-flops 2 weeks ago and made it angry. Who knows? But it flares up randomly. I'll just be like, I'm not even on my feet, and I'm like, oh, that burns. It's like somebody's like slowly turning on a fire, and then it slowly turns off. Welcome to clinical everything. So, that's the latest and greatest in my world. All is good overall, though. I'm doing really well. I feel really good. My energy levels are good. I'm going to show you my armpit. Like you can see, this is pretty dark now. It's tanning. I call it tanning. I don't know if it's just darkening. It's starting to peel a little bit right there, kind of. I don't feel, it's not itchy anymore. It doesn't hurt. And my armpit has already peeled, and it's doing really well. I just keep putting the Aquaphor on. But all in all, I'm very grateful that I feel as good as I do. I try my best to take care of my body as well as I can, so it has me helping it to make it stronger and to be in a better shape for fighting any side effects of anything of what I'm going through right now. Yeah, that's pretty much it for this week's vlog update, video update. I don't have any more appointments this week. Thank God. I needed a week off. I will be very busy with my daughter because she is out of school. Yay! And her summer camp doesn't start for another 2 weeks, I think. Lord help me. We're just going to be very busy with her. I'll be very busy with her, doing stuff all day long to keep her entertained and happy. And it's also just good for me to be active. So, but yeah, you never really realize until you're in it how much stuff goes in to cancer treatment. Like even after you get like the big stuff done, like, okay, I already did the chemo, rang the bell, awesome. Had my surgery, awesome. Did radiation, rang the bell, awesome. And the journey still continues, and it's going to continue for 5 years. And it's like, now I did really well. I was nervous taking the Arimidex and like, oh my God, what are my side effects going to be? And so far so good. Just the hot flashes and like random joint pain on my foot, which I think was self-induced. I don't know. But now I have to worry about the side effects of a new drug. And then, oh, I forgot to mention that when I do get these infusions, they will be twice a year. The I already forgot what it's called, but the bone strengthener, where I get it at the actual chemo infusion center on an IV. Once you get them, the side effects of that is within the 24 hours of getting it, you could get a low-grade fever, you could have fatigue, and then I forget the third thing. I'll list it here. But there's just side effects for everything, and I'm just hoping to God that as long as I continue to take care of my body and nourish my body and give it what it needs, the side effects will be very minimal, if nothing at all. So cheers to that, and here's to hoping that's what happens to me. But if you are going through the same treatment as me, or you're going to be going through the same treatment as me, I'm just like to share my journey with you so you know what you're up against and what's headed your way, what to expect, and just share my experience with everything, because sometimes it's not as bad as you think it's gonna be. I'm still gonna keep a positive mindset no matter what. And yeah, so just take things one day at a time, one hurdle at a time, and one step of your journey at a time. Because when you are diagnosed with cancer of any kind, doesn't have to be breast cancer, any cancer, it sounds like insane, like how long your journey is going to be. But if you just take it in little chunks and try not to worry about the next step, like don't worry about it yet, because there's a saying where if you're worrying before it happens and then nothing happens, you just worried for nothing. But if you worry about it and then you worry again when it happens, you just worried twice. So why go through it 2 times? Like, just worry about it when it comes up. I know it's hard to do that because you're probably stressing out like a normal human being would when you find out about having a cancer diagnosis. But just try your best. Just try to, okay, what's your first treatment plan? Chemo? All right, let's just focus on chemo for right now. Don't worry about surgery. Don't worry about radiation. Don't worry about the hormone therapy. Don't worry. Just don't worry. Worry about what's in front of you right now, and do your best to try to be your best, and stay as positive as possible. Take care of yourself. Give yourself grace. Rest if you're tired. Hydrate. I'm a huge advocate about hydrating anyway, and especially during treatment. Yeah, just take things one day at a time, because I say this in all my videos, but I mean it. We only have today. We are not promised tomorrow. We woke up today, and that's awesome, and we're gonna make today as good as possible. And if today is a yucky day, that's fine. I know tomorrow is not promised. I sound so contradictory right now. Tomorrow is not promised, but if there is a tomorrow, you can have a better day tomorrow. I mean, let's just get through today, because that's all that's guaranteed right now is today. Okay? So promise me that you're going to take good care of yourself. You're going to take this head on, one day at a time, one hurdle at a time, one infusion at a time, one radiation treatment at a time, one hormone pill at a time. You got this. I got this. We got this. I have your back. You have mine. We're doing this together. I know you can do it, and I'm proud of you. So you got this, and just try to keep your head up as much as you can. All right, so that's pretty much it for this week's video update. I do have some appointments next week, so I will take you along with me on those. One of them is physical therapy. I forget what the other ones are, but you're coming with me for all of it, and I'll keep you updated as I get my medication and all that stuff going, and make the appointments for the infusions and all that stuff. So You'll be seeing me weekly, at least. And I also have other video plans that I'm planning on doing once my daughter's in summer school. So, all right. I love you guys so much, and I hope you are having the best day and a great week. And I better see you in the next one. Bye, everyone.